Nick Majerison here. Welcome to Top Med Talk. Time now for a conference highlight. This piece is taken from a longer conversation to be found in the podcast show notes. It features Desiree Chappell with two guest speakers from the American College of Perioperative Medicine's 2018 conference. It's J Schneidewind, president of the AARP, and Kevin Bozic, chair of surgery and perioperative care at the Dell Medical School. Have a listen.
Top Med Talk.
Thank you for having us. My name is Kevin Bozic, and as was mentioned, I'm a chair of surgery and perioperative care at the Dell Medical School at UT Austin. I'm an orthopedic surgeon, and I have, throughout my career, really tried to gain a better understanding of the impact of what we do in the healthcare profession on our patients, and I was frustrated by the types of tools that we were using to measure that, process measures, structural measures, and those are not things that resonated with my patients. As an orthopedic surgeon, my goal is to improve the health of the people that I treat by optimizing their quality of life, reducing their pain, and improving their function. And I learned early on that the only way to improve those is to measure them and measure them rigorously in every patient and every encounter. And so I've been on this journey now for about 15 years and have been through the evolution that's occurred in this country, and I'm very optimistic and enthusiastic about the direction it's going, especially with conferences like this and being able to attract a multidisciplinary group of people from the AARP, from patients to providers of different disciplines and payers to really come together around this goal, because ultimately I believe that for all of us, no matter where we sit, all of us in healthcare, our goal is to optimize the health of the patients that we come in contact with.
And Eric, can you tell us a little bit about what you do and why value-based care matters to you?
Well, I have the privilege of being the volunteer president of AARP, and I serve on the National Board of Directors, and my position gives me the great pleasure of going out and meeting our members and the communities in which they serve throughout the country. They're just a great group of people who really want to make life better in a variety of ways for people, not only those 50 plus, but their children in particular. So we work on programs, and at the health sector, we have a view that I think I can summarize as saying that obviously the healthcare system is incredibly important. Health outcomes are important. But we think that our members many times, have a view that they're not getting exactly, what they want. Many times you go into healthcare and the question is, should you have an operation or a procedure? But our members really tell us that they want health so that they can do something. The famous example, a woman said, I want treatment so I can dance at my daughter's wedding. I want to be happy. I want to be fulfilled. And so to do that, what AARP is finding is that there are a number of practical measures that we can push for. We can't do everything. One of the measures is people benefit from having a health professional who works with them, helps them navigate through the health maze, get them the things that make their life better. That may not be a doctor. It may be a nurse practitioner. It may be a nutritionist if they have a nutrition problem. So let's configure the healthcare system so that those skills are available to people that may be more effective for them than some medical procedure. So we push for expanded scope of practice for nurses and nurse practitioners. We hopefully support plans which take a look in the range of healthcare services provided. Take a look at issues like isolation. Take a look at people who are depressed. And maybe by dealing with something like that, dealing with a hearing loss, you will drastically minimize the number of health issues they have, and in many cases for a great deal less money. So AARP is looking at what the members want, and they tell us that they want issues looked at that may be outside the normal range of medical practice, but that would make their life better. And then we go into the arena of policy, both federal and local, and try to get those measures included in healthcare.
I wanted to just follow up on a point that was just made, that if you look at what we in this country spend on social services, it's about it's about average. It's about the median for OECD countries, but it's disproportionately spent on care and health care as opposed to other social services, which we know heavily influence health. And so our model in Austin is we really are truly trying to improve the health of the community that we practice in. And in order to do that, we realize that only about 10 to 15% of someone's health is influenced by the care they receive from healthcare professionals. So it requires interaction with educators, with other types of social services. It requires safe places to live. It requires a healthy diet. There's so many other things that play into socioeconomic status, education, that we understand that thinking and isolating care as the primary tool to improve health is not very effective.
And that's exactly what we believe, and what has been so stimulating about this conference is that you have highly skilled medical professionals who recognize that the full range of services can be far more effective collectively than individual ones. And this seems to be going mainstream by some, I must say, very eminent people in the field.
Top Med Talk.
Don't forget, of course, that is taken from a longer conversation, which you can find in the podcast show notes. Don't forget, you can meet the Top Med Talk team. All you need to do is go to ebpom.org, click on the section marked Meetings.